Hi, I'm Julia Halverson, the Executive Director for Minnesota Connect Aphasia Now. I'm here today to talk to you about seizures and stroke. A good friend of MinCan's, who had a stroke several years ago, recently had a seizure. It's affected his ability to drive and do some of his activities for the next 3 months while he adjusts to his medication. In a recent visit, he said to me, "I wish somebody would have told me that this can happen after a stroke." So in honor of our friend, we're talking about that today. So what is a seizure? A seizure is a brief surge in electrical activity in the brain, which disrupts the communication between the neurons in the brain. Seizures can occur whenever there is scarring on the brain, and as a result of a stroke, a scar can occur, which can then trigger a seizure. The International Stroke Conference in 2016 reported on seizures and stroke, and here's what they found. 15% of stroke survivors within 3.5 years following their stroke had a seizure. Seizure risk was highest for people who had a hemorrhagic stroke, which means there is a blood vessel that bursts in the brain, causing damage to the brain. There's not a lot of information about how to prevent a seizure after a stroke, and researchers have said that more work is needed to be done in this area. Plenty of rest and decreasing stress seems to be important in general, and you should never abruptly discontinue your medication without your doctor's instructions. Abruptly stopping your anti-seizure medication can trigger a seizure. If you have any advice or experiences to share with others, please respond to this post. This affects more people than you might know. Thanks for listening.